The silent importance of screening. Ladies and gentlemen, dear listeners, welcome to this important journey of knowledge and awareness. Today we are going to talk about one of the most crucial topics in women's health, breast cancer screening. Breast cancer is not just a medical term. It is a reality that touches the lives of millions of women and their families across the globe. It is a condition that can bring fear, uncertainty, and hardship. Yet, at the same time, breast cancer is also a condition where knowledge, prevention, and early detection can save lives. When it comes to breast cancer, time matters. Detecting the disease early can make the difference between a short, manageable treatment and a prolonged, difficult journey. Screening is not simply a medical recommendation. It is a tool of empowerment. It gives women the ability to take control of their health, to act before the disease progresses silently, and to protect not only themselves, but also the people who love them. Over the next hour, I will walk with you through this subject in depth. We will explore what breast cancer really is, why screening matters, what methods exist, and how guidelines differ across ages and risk groups. We will talk about the benefits, the risks, the myths, and the truths. We will also reflect on how lifestyle, awareness, and access to healthcare all play roles in the fight against breast cancer. I invite you to listen carefully, with openness and curiosity. Whether you are a woman thinking about your own health, a family member wanting to support a loved one, or simply a person who values knowledge. This conversation might not just be information, it could be life-saving guidance. Chapter 1. Understanding breast cancer. To appreciate the value of screening, we first need to understand what breast cancer is. The human breast is made up of glands, ducts, fat, and connective tissue. The glands produce milk, the ducts carry it to the nipple, and the fat and connective tissue provide shape and structure. Like any other organ, the breast is made of cells, and these cells can sometimes lose control over their growth. Breast cancer begins when cells in the breast start to grow abnormally. Instead of dividing in an orderly fashion, they multiply uncontrollably. Over time, these cells may form a lump or a mass called a tumor. Some tumors remain benign, meaning they do not spread and are not life-threatening. But malignant tumors, those that are cancerous, can invade nearby tissue and spread to other parts of the body. Breast cancer is not one disease, but a spectrum. There are different types depending on which cells are affected. Some begin in the milk ducts, others in the glands, and still others are more aggressive or more difficult to treat. The type of breast cancer, its size, its stage, and its biological characteristics all influence the treatment approach and the outcome. Now, why does breast cancer matter so much in global health? Because it is the most common cancer among women worldwide. According to the World Health Organization, millions of new cases are diagnosed every year. And while treatments have improved dramatically over the past few decades, prevention and early detection remain the most effective strategies to reduce suffering and save lives.
Chapter 2. Why Screening Matters. Imagine a fire starting in a house. If detected in the very first moments, just a spark, it can be put out with minimal damage. But if discovered only when the flames have spread, the consequences are far greater. Cancer behaves in much the same way. When breast cancer is detected at an early stage, the chances of successful treatment are high. Women may require less aggressive therapies, have shorter treatment durations, and enjoy better quality of life. In contrast, when cancer is discovered at a later stage, the options are fewer, the treatments are harsher, and the outcomes are often less favorable. Screening allows us to detect cancer before symptoms appear. A woman might feel perfectly healthy, with no pain, no lump, no change in her breast. Yet screening can reveal abnormalities invisible to the naked eye or even to the touch. That is the power of technology and medical science. Another important point: early detection not only saves lives, but also reduces the economic and emotional burden on families and society. Treatments for advanced cancers are costly, both financially and emotionally. Families may struggle with hospital visits, side effects, and the uncertainty of prognosis. By contrast, treating an early-stage cancer is usually simpler, less expensive, and far less disruptive to life. So when we talk about screening, we are not just speaking about medicine. We are speaking about hope, dignity, and the right to live a healthier, longer life.
Chapter 3: Methods of Breast Cancer Screening. There are several methods of breast cancer screening. Each has its role, its strengths, and its limitations. Let's walk through them carefully. Mammography. Mammography is the cornerstone of breast cancer screening. It is essentially a specialized X-ray of the breast. By compressing the breast between two plates, the machine captures detailed images that allow doctors to spot tiny abnormalities. Mammograms can detect tumors too small to be felt by hand. Mammography is widely studied and has been shown to reduce breast cancer mortality in women over the age of 40, particularly between ages 50 and 69. That is why many national guidelines recommend regular mammograms for women in this age group. However, mammography is not perfect. It can sometimes miss cancers, especially in women with very dense breast tissue. Dense breasts contain more glandular tissue and less fat, making it harder to see tumors on an X-ray. Mammograms can also produce false alarms, results that look suspicious but turn out to be benign. This can lead to anxiety, further testing, and even unnecessary biopsies. Still, despite these limitations, mammography remains the best tool we currently have for widespread screening. Breast ultrasound. Ultrasound uses sound waves to create images of the breast. It is not typically used as a primary screening tool, but it is very useful as a supplement to mammography. For women with dense breasts, ultrasound can reveal abnormalities that the mammogram may miss. It is also widely available, relatively inexpensive, and free of radiation. Magnetic resonance imaging, MRI. Breast MRI is the most sensitive imaging technique we have. It can detect cancers that other methods overlook. However, it is costly, requires injection of a contrast dye, and is not always available. For these reasons, MRI is usually reserved for women at very high risk. For example, those with strong family histories of breast cancer or genetic mutations like BRCA1 or BRCA2. Clinical breast examination. This is when a trained healthcare provider, such as a doctor or nurse, physically examines the breasts for lumps, thickening, or other changes. While not as precise as imaging, it remains an important part of breast health awareness, especially in areas where advanced technology is not accessible. Breast self-examination and awareness. For many years, women were taught to perform monthly self-examinations. Today, guidelines emphasize breast awareness rather than rigid self-exams. This means encouraging women to know the normal look and feel of their breasts and to report any changes promptly. Lumps, nipple discharge, skin changes, or persistent pain should always be taken seriously. Chapter 4: Screening Guidelines by Age and Risk. Screening is not a one-size-fits-all process. The recommendations vary depending on a woman's age, medical history, and overall risk factors. Understanding these guidelines helps each woman make informed decisions together with her healthcare provider. Women under 40. For most women under 40 who do not have special risk factors, routine screening is generally not recommended. Why? Because breast cancer is relatively rare in this group, and mammography is less effective due to denser breast tissue. However, awareness is key.
Women should learn about their own bodies, recognize changes, and understand their family histories. For those with strong genetic risks, screening may begin much earlier, sometimes as early as age 25. Women aged 40 to 49. This is a somewhat controversial age group. Some guidelines recommend starting routine mammography at 40, while others suggest waiting until 45 or 50. The reason for debate is that while screening can save lives, it also carries risks of false positives and unnecessary biopsies. Therefore, in this age range, the decision is often individualized. Women should talk with their doctors, consider their personal risk factors, and weigh the potential benefits and harms. Women aged 50 to 69. This is the group with the strongest evidence supporting screening. Regular mammography every 1 to 2 years is widely recommended for women in this age bracket. Studies consistently show a reduction in breast cancer deaths when women in this age group undergo regular screening. Women over 70. For women aged 70 and above, recommendations depend on overall health and life expectancy. If a woman is in good health and expected to live at least another 10 years, continuing screening may still be beneficial. However, if serious health conditions limit life expectancy, screening may not provide meaningful benefits. Women at high risk. Some women carry a much higher risk of breast cancer than the general population. This includes women with BRCA1 or BRCA2 genetic mutations, those with strong family histories, those who had chest radiation therapy at a young age, or those with certain rare syndromes. For these women, intensive screening is recommended, often beginning at an earlier age and often including MRI in addition to mammography.
Chapter 5: Benefits and Risks of Screening. Every medical intervention carries both benefits and risks. Breast cancer screening is no exception. The benefits are powerful. Reduced mortality from breast cancer. Detection of smaller, less advanced tumors. Less aggressive treatments when cancers are found early. Greater peace of mind when results are normal. But we must also recognize the risks. False positives, when an abnormality looks suspicious but turns out not to be cancer. This can cause anxiety and lead to further tests. Overdiagnosis. Sometimes screening detects cancers that grow so slowly they would never have caused harm in a woman's lifetime. Yet once discovered, they often lead to treatment. Radiation exposure. Although minimal, mammography does use low-dose X-rays. Over a lifetime, repeated exposure is considered safe, but it is not entirely risk-free. False negatives. In some cases, especially with dense breast tissue, a mammogram may miss a cancer that is actually present. Understanding both sides helps women make informed decisions. Importantly, most experts agree that for women in the recommended age groups, the benefits far outweigh the risks. Chapter 6: Global Perspectives on Screening. Breast cancer is a global issue, but the approach to screening varies from country to country. In high-income nations, regular mammography programs are widely available and supported by national health systems. Public campaigns raise awareness and participation rates are high. These countries often see reduced mortality from breast cancer as a result. In low- and middle-income countries, however, challenges remain. Access to mammography machines is limited. Trained radiologists may be scarce. Many women do not seek care until symptoms become obvious, and by then, cancers are often advanced. In such settings, clinical breast exams and awareness campaigns play a crucial role. Even without mammography, encouraging women to recognize changes in their breasts and seek medical advice early can make a significant difference. International organizations continue to push for broader access to screening worldwide. Equity in healthcare is a moral imperative. No woman, regardless of her geography or income, should be denied the chance of early detection and life-saving treatment. Chapter 8: Lifestyle, Risk Reduction, and Empowerment. While screening is essential, it is not the whole story. Prevention also plays a vital role.
certain lifestyle choices can reduce the risk of breast cancer. Maintain a healthy weight. Obesity, particularly after menopause, is linked with higher risk. Stay physically active. Regular exercise not only benefits the heart and mind, but also lowers cancer risk. Limit alcohol. The more alcohol consumed, the higher the risk of breast cancer. Do not smoke. Tobacco is linked with multiple cancers, including breast cancer. Breastfeed if possible. Studies suggest that breastfeeding may slightly lower breast cancer risk. Eat a balanced diet. Diets rich in vegetables, fruits, whole grains, and lean proteins contribute to overall health and may lower cancer risk. Most importantly, women should feel empowered. Knowledge is power. By understanding risks, taking preventative steps, and participating in screening, women can shift the balance in their favor. Chapter 8. Myths and Misconceptions. There are many myths about breast cancer and screening. Let us clear a few of them. Myth 1. Only women with a family history need screening. Truth. While family history raises risk, most women who develop breast cancer have no family history at all. Myth 2. Mammograms cause cancer because of radiation. Truth. The radiation dose from a mammogram is extremely low, similar to a few months of natural background radiation. The benefits far outweigh the risks. Myth 3. If I have no symptoms, I don't need screening. Truth. Breast cancer can grow silently without symptoms. Screening finds cancer before symptoms appear. Myth 4. A lump always means cancer. Truth. Many breast lumps are benign, but every lump should be checked by a healthcare provider. Myth 5. Screening guarantees that cancer won't be missed. Truth. While screening greatly improves chances of detection, no test is perfect. That is why awareness and follow-up are also important. Dispelling myths reduces fear, removes barriers, and builds confidence in the screening process.
Chapter 9. Emotional and Social Dimensions. Screening is not only a medical act, it is also an emotional journey. Many women feel anxiety before their appointments. What if they find something? This fear is natural, yet facing the fear and acting anyway is an act of courage. For women who receive abnormal results, the waiting and uncertainty can be difficult. That is why support, both from healthcare professionals and from family, is so essential. Compassion, clear communication, and reassurance can transform a frightening experience into a manageable one. On a broader level, societies benefit when women are healthy. Families are stronger, communities are more resilient, and economies are more stable. When we invest in women's health, we invest in the health of future generations. Chapter 10. The Future of Breast Cancer Screening. Medicine is always advancing. Researchers are exploring new ways to improve breast cancer detection. Digital breast tomosystem, also known as 3D mammography, provides layered images of the breast and may improve detection in dense tissue. Artificial intelligence is being developed to help radiologists read mammograms more accurately and consistently. Blood tests and biomarkers may one day allow us to detect cancer through a simple sample, long before tumors are visible on imaging. Genetic testing is expanding, helping women understand their risks and personalize their screening strategies. The future promises even greater accuracy, less anxiety, and more tailored approaches to each individual woman. Closing chapter. A call to action. Let us pause and reflect. Breast cancer remains one of the greatest health challenges for women worldwide, but it is also one of the conditions where we can make the biggest difference through early detection. Screening saves lives. It empowers women. It reduces suffering, and it is within our reach. So here is my message to every woman listening today. Take charge of your health. Learn about your body. Know your family history. Talk to your doctor. Follow screening recommendations.
Encourage your sisters, mothers, daughters, and friends to do the same. Remember, a few minutes for a mammogram, a moment of courage to face the unknown, could translate into decades of life, joy, and shared experiences with the people you love. Breast cancer is a battle we can fight. With awareness, with science, with compassion, and with action, we can win. Thank you for listening. Thank you for caring. And thank you for taking the steps that may save a life, perhaps your own.